I think an ideal doctor is someone who is respectful about his patients and compassionate, so that after the patient leaves the clinic, he's happy that the doctor has respected his intelligence and provided him a shoulder to cry on if that's what he required. The golden rule is treat your patients the way you would want your mother to be treated. Exactly the same thing applies, I feel. An ideal patient is one who trusts and respects his doctor. The trouble today is there's so much distrust because a lot of people feel that the profession has become commercialized. But honestly, if you can't trust your doctor, you're going to find it very hard to get better no matter what. I think we need to remember that it's a two-way street. It's a dance between two people and it's not just one way. So that if patients start beating up and abusing doctors, it's going to be very hard for doctors to continue treating patients with respect. And the tragedy is that it's now becoming a negative vicious cycle. And I think it's high time we broke that by explaining to patients, look, we care about you, we want you to get better, which is why we became doctors in the first place. I must say things have changed dramatically. I remember when we first started, IVF was so new. There was so much confusion about what it involved. People weren't sure whether you're using someone else's sperms or whether you were actually making babies in the laboratory and then giving it to the patient. So a lot of patient education involved in those early days. And it was hard because even getting simple things like test tubes and culture medium, I remember having to go to the customs officer and explaining to them what we were getting because we had to do the importing ourselves. So things have become a lot easier now. Patients are much more aware. There are many more IVF clinics and it's far easier to get a lot of these supplies. So to that extent, I think because the technology has matured and because the profession and patients have matured, life has become a lot easier. You have distributors and suppliers because the demand for all these products has become so much. Otherwise, I remember we would have to plan for this months in advance. We would actually have to import, open an LC, get the invoice. Then when it came in, you would have to explain to the officer, ye kya hai, because it didn't seem to fit into his manual. And there was lots of confusion and you spent a lot of time doing that. But those were early days, so we still have fond memories. I remember when we get liquid nitrogen in order to freeze sperms, it wasn't very easily available. The only people who would do it were the veterinarians. So you'd actually have to go to RA Milk Colony to fill in your liquid nitrogen containers. Things have become a lot easier now. I think everyone acknowledges that there is a lot of scope for treating infertility in this country. There is a huge demand because infertility still carries a huge social stigma. I think part of the tragedy is that the trust and respect which people had for infertility specialists has gone down. And I think that's partly we as IVF doctors are to blame because some doctors haven't been very upfront or very ethical in the way they've dealt with their patients, as a result of which you have to keep on earning that trust every time. And I think there are lots of opportunities, whether it's the government. There's no reason why the government shouldn't offer free IVF treatment as part of their family planning and welfare. Family planning doesn't just mean limiting a family size. It also means helping infertile couples to have babies. And these are great citizens for the future. Equally important, for example, for insurance. Why isn't insurance treating infertility like a medical disease and why isn't insurance being willing to reimburse? And I think there's a big problem with training. Isn't it a tragedy that you have MD gynecologists who know all about IVF because they've read it in their theory textbooks, but have never seen a single IVF cycle in their life because IVF is not offered. And if they started offering IVF in medical colleges, the students would learn, they'd be able to do a good job, poor patients would have access, and it really wouldn't be very expensive. It'd be extremely affordable. So I think there are lots of challenges, but I look on every challenge as actually being an opportunity. The great thing is you have large numbers. You can easily create centers of excellence which can do large volumes. And obviously the larger the volume you do, because of the economies of scale, you can start doing it much more affordably. And because Indian patients are usually much younger, the chances of getting success also is much higher. I think it's just a question of getting everyone on the same page together and ultimately remembering that we need to learn to put our patients first. And when that happens, I think a lot of these things will fall into place automatically. So I'm extremely hopeful. We've made enormous strides over the last 25 years. I hope it won't take us another 25 years to continue improving. And hopefully as the country becomes a little bit richer, the pace of progress would start getting compressed and we'd see lots of changes. I run Malpani Infertility Clinic with my wife. We're a boutique IVF clinic. We've been doing this for many years. We take pride in the fact that we don't have any assistants, that we actually talk to all our patients one-on-one. We have a lot of experience and a lot of expertise. We treat each individual patient by name. We don't give them numbers. And we spend a lot of energy in educating these patients. What we provide information therapy. So for example, on our website at IVF India, we have a comic book, we have videos, everything which a patient knows, so a patient can make a well-informed decision about whether they need IVF or not, and if they need IVF, then which doctor to go to. And basically we've crystallized it into one simple thing which every IVF patient should ask the doctor. Do you provide photographs of the blastocysts which you transfer? And I think if every clinic started doing that, there would be openness, there would be transparency, there would be documentation, and really patients wouldn't get taken for a ride. Good for patients and good for doctors as well.